and distinguished guest on the dais, Dr. Rajni Chandar, Professor Jayasuriya Homeopathic Medical College, our colleague and good friend, a learned faculty from Jayasuriya. He would be delivering the memorial oration today. So Dr. Gauribai Kirtane was a life member of our association, and she also served in various capacities in our association, and she was a dedicated family physician. Though she was a pediatrician, she used to run her practice as a family practice, and she developed great love towards homeopathy, though she was trained in allopathy and did her PG from UK, and she did her medicine from Lady Hardinge College from New Delhi. So she had a very lucrative practice in Hyderabad city in those days. She used to practice in Gauligooda, and she used to sincerely attend every monthly oration all through her life till she passed away. So 2 months or 3 months before she passed away, she presented herself in our orations, and she was very keen that we invite homeopaths. Maybe whatever is the topic, but let homeopaths be invited and let homeopathic talent be projected in society in a better way and glorified way. That was her wish all through. Whenever we used to call some eminent allopaths and other faculty people, so she used to express her unhappiness. Why, doctor, you don't find a homeopath speaking all this? So she was so much particular, even while instituting this oration. When she was alive, she instituted it. It was not a memorial oration before. So later we converted it to memorial oration. So, and every time she used to tell, at least on this oration, you invite a homeopath. So much love she had towards homeopathy. And she used to practice in Shantabai Hospital in Abbots. So there, her niece, she is a gynecologist, she practices there. She also uses homeopathic medicines widely in her gynecological practice and obstetric practice. So she trained many of our homeopaths in her hospital. In Shantabai Hospital also, Dr. Annapurna used to go there, Dr. Hema Prabha used to go there and learn. So many people she gave guidance, and she was very humble. Though she was so much learned, she had a lot of humility. So even if it is a very young novice practitioner delivering a lecture, she used to sincerely sit in the front line, take down all the notes, and she also used to make some questions or suggestions. So that was the kind of person she was. On this occasion, we respectfully pay our heartful homage to her, and we thank their family. We thank her family for sponsoring this event. And I profusely thank all of you. And I thank the speaker for having accepted our invitation and expressing his willingness to deliver this oration. Thank you, one and all. Thank you.
Now I request Dr. Durga Prasad sir to speak a few words on this Gauribai oration.
Good evening, all. Respected President Dr. Gopal Krishna sir, and our beloved speaker, Professor Dr. K. Rajini Chandra Garu, and Vice President Dr. C.V. Swami, Joint Secretary Dr. Gautam Ralabandi, and member Dr. Shruti, and our duty doctors, and all the members. On behalf of Homeopathic Medical Association of Telangana, it is my privilege to introduce our sponsor of this evening, on whose memory we are conducting this oration today. Dr. Gauribai was born on 2nd February 1920. She graduated in 1943 in MBBS, and later she did her DGO from Madras. Gauribai Kirloskar married to Dr. S.S. Kirtane in 1948. Both studied in UK, from where Gauribai passed DCH London. Dr. Gauribai was a true family physician, as she treated the whole family as a unit rather than the individual patient. She practiced in Gauligooda, Hyderabad for more than 30 years. Then she developed some sort of interest in homeopathy as she came in contact with the leading practitioners of that time, like Dr. Sheshachari and others. She was an honorary professor of pediatrics in the Nilafar Hospital for a couple of years. And she used to practice allopathy and homeopathic simultaneously. She slowly gravitated towards pure homeopathic practitioner, and alternative modalities of treatment also she developed, and she advocated pyramid power, pranic healing, Reiki healing. She was well read and up to date in daily happenings in the country and abroad. She led a full life of 92 years and passed away after a brief illness of 2 months. And the important thing is, before her death only, while she was alive, she instituted her lecture on her name, just Gauribai Kirtani Aration, just 3-4 years before her death. And till last, before a few months before the oration also, she used to come and attend all the orations every month. That much interest she was having that time. And today, we are very much lucky, and we are privileged to have memorial oration on her name. And I request you to follow our speaker, Dr. Rajini Chandra Garu, who is going to speak on the experience of homeopathic rare remedies in general practice. Rather, it is a lesser known drugs in our materia medica. So I request Dr. Rajini Chandra Garu to give his speech. Thank you. Before speech, I request Dr. Kiran Barade to introduce our beloved speaker, Rajini Chandra Garu.
Good evening to one and all. At the outset, it's my pleasure to introduce you today's speaker, Dr. Rajni Chandra sir, on this auspicious occasion of Dr. Gauribai Kirtane Memorial Oration. Professor Dr. K. Rajni Chandra sir, presently working at JSPS Government Homeopathic Medical College, Ramantapur, Hyderabad. Sir, Sir is Sir in the Department of Practice of Medicine and HOD Department of Pediatrics. Sir studied UG, MBSH course from JSPS College Government OU and PG, MDH repertory from the same institution under NTR Health University. Dr. Rajni sir is having 34 years of clinical experience where he worked as a medical officer of government dispensaries, from then entered in the teaching with the experience of 28 years from lecturer to assistant professor, now as a professor since last 64 years. And 6 years, sorry. Awards, meritorious since service award for teaching received from the district collector Metchal Malkajgiri on 15th August 2022. Sir is the senior Senate member of KNR University of Health Sciences. Besides his teaching, Sir has also vast additional professional experience as examiner and paper setter for the UG and PG students at NTR and KNR Universities of Health Sciences. for PG students at Rajiv Gandhi University of Health Sciences and also Kerala University of Health Sciences, plus at Ayurvignan Vishwavidyalaya, Jabalpur, MP, with Vinayaka Mission, Salem. He also presented papers at CME program at Dr. Gururaj Government Homeopathic Medical College and Government Homeopathic Medical College of Kolkata. Also, his approval guide by Central Council of Homeopathy since 2009 and guided the students of 15 batches. He is the former Board of Students member at Rajiv Gandhi Institute of Medical Sciences, Bangalore, Karnataka. So let us hear from Sir on the topic, my experience with homeopathic rare remedies in practice. Thank you.
Thank you, Dr. Kiran. Respected Gopal Krishna Garu, President, Homeopathic Medical Association, Telangana. Dr. G. Durga Prasad Garu, General Secretary. Dr. Venugopal Gauri, Convener, Homeopathic Medical Association. And the doctors who have assembled here, off the line and on the line. Good afternoon, one and all. At the outset, let me thank the organizers for giving me the opportunity to present myself here to talk about the present topic today. In fact, I have seen few youngsters are there. I call them budding doctors entering into the private practice, right? They have come over here and hope some of them will be joining again online. I've been asking Dr. Gopal Krishna Garu, since how long you have been encouraging this kind of or conducting these kind of medical seminars? And he said more than 30 years. In fact, sir, I would like to give a big hand to the organizers for conducting this kind of programs. Thank you. So before I start the presentation, my topic is my experiences with the rare remedies. Okay. How many homeopathic drugs are there? Especially the young doctors here. How many? There are more than 2,500 to 3,000 drugs, homeopathic drugs are there, of which 70 to 100 are polycrus. Why we call them polycrus? Why? Because these drugs have been proved, reproved, verified clinically, and they have wide range of action. We call them as polycrus. Remaining drugs, which we very less use them in day-to-day practice, they are common remedies, and there are certain other remedies where they are very less proved, not reproved, but only clinically verified. They are called as rare remedies. So today I would be talking about these remedies. But before going to that, let me just explain to you why I got interest in this. Why I got interest in studying these drugs. In fact, it all started when I was doing my internship. My internship is way back in 1987, 88. One of my friend, he was working in Sagar Homeo stores. Evening after the duty was attending there. Very next day he came down to our college. He said, I'm finished. I'm ashamed because I couldn't answer a question. What is that we asked? One of the customer came with a small slip. And he was asking Sagar Homeo store's proprietor,
the drug. And proprietor has seen the slip like this and like this. He couldn't follow it. And being a doctor, he approached my friend there. And my friend said, he has also seen, but he also doesn't know. He said this could be an allopathic drug. You see the funny thing. Then that gentleman has opened Boric Medica and shown the drug. And he is using, and he says that with that drug, he is getting excellent results. In fact, in our study period, we were exposed only to the Kent Materia Medica. I'm talking about the Materia Medica our teachers taught way back in 1970s, 80s, right? So Kent was the dominant study. Boric hardly we touched. So that could be the reason my friend couldn't answer. But nowadays, students are used to the Boric, right? Then there is one more drug also which has opened my or kindled my interest to study these rare drugs. And definitely after going through the drugs, I found them very, very effective, right? So when these drugs are useful, anyone? Of course, we have polycross and we have rare drugs. When does these rare drugs useful? These drugs are useful where you have only one particular symptom. Let it be a clinical symptom or a peculiar symptom. These drugs can be used as a patch-up remedies, or if it is indicated, it can cure the case, or as Hmat has said, partially suited remedy may unlock the case, right? So that is the reason we have so many drugs in our Materia Medica. When I was working as a medical officer in Madanapalli, 92, 95, I came to Hyderabad around 93 or 94. Why? Because there was shortage of medicines in the dispensary. And a senior faculty member was there. He said, 25 drugs are enough for you. Why? Because if you look at all the senior practitioners, hardly they go beyond 75 or 80 drugs per day. But it is better we have the armamentarium of all of the drugs so that we can use these drugs whenever there is required. There is no substitution in homeopathy. Is there? There is no substitution in homeopathy. These rare drugs could be the indicated drug for that case, so it is better. So let us just start the topic today with a drug which started interest in me to read these rare drugs. Yeah, that is none other than Comocladia dentata. Have you heard about this drug? Right. No, of course. Many of the senior practitioners who are here online or offline might have used them. So that's what when I say rare, it could not be rare for them, but better we just go through them, right? Yes, especially for the younger generation keeping in view. Right, Comocladia dentata, this was the drug that particular gentleman was asking, and my friend did not know what it is. It is a drug used for glaucoma. And the indications are ciliary neuralgia with eyes feeling large and protruded. This is the old terminology, ciliary neuralgia. Now it is known as cluster headache. Once I say cluster headache, everyone knows it, right? Our books are written long back, and Boric was written in 1905. So we do come across the old terminology, and the new terminology for ciliary neuralgia is cluster headache. And these are the few indications for that, where eyeball is large, protruded, especially right, and it's aggravated from warmth of the stove, sees only glimmer of the light. And if you go through the symptomatology of a glaucoma, more or less it fits into this. So the first and foremost drug is Comocladia dentata, right? What I do is I'll be sharing my experience. Not only this, I will be sharing some others' experience also, which I have heard, right? And this another drug is amygdalis persica. In fact, this is a very good drug for hyperemesis gravidarum. Once we say hyperemesis gravidarum, we come across symphoricarpus, arsenicum album, ipecac, colchicum, etc. But one Dr. Ramana Rao, he's an allopath. He's an allopath, MD general practice, he's practicing homeopathy. He rates amygdalis persica over other drugs, especially in morning sickness. Taking a cue from him, I too started giving this with a very good result. I give in lower potency, especially 6 and 30 potency. This is other drug, that is amygdalis, persica. This you know, right? Ibis candensis is the first drug of our boric medica. But there is some peculiarity of this. I don't know whether you all know it or not, right? So it has its ravenous appetite, it has its desires, etc. But you just see the second one, tendency to eat far beyond capacity of the digestion. This is one of the characteristic feature I found very effective in this. Many times patients do tell us, or parents do tell us, my child doesn't know when to stop while eating. And in fact, I was going through the net and this actually becomes a habit. It becomes an addiction where he goes on eating at one go and eating and getting suffer from the over distension of the stomach, etc. So the drug what we give is Abiscan. Antincrutum is also like this, but antincrutum is continuous muncher. It doesn't stop. But whereas this boy or a patient sits at one time, he always goes. Once in a while eating beyond capacity is okay. Your mother cooked a delicious dish. Come festival, our next Chaturdashi, Chaturthi, then we eat. But this boy or this patient, he always can have a tendency to eat beyond capacity, and you have Ibis canadensis. And I found it gives good results for this. And Bariatamur, we all know it is for tonsillitis, right? But I found there is a third or fourth line of first para of Boric, which says high systolic and low diastolic. What is this? This is a condition where you see in arteriosclerosis. So Boric, in fact, we have been to, me and my team of friends, we call them as stretcher mates because from first year to final year we were there. We are all together, boys and girls. Whoever wants to teach homeopathy, we went there. We went to Dr. Ramana Rao, Sir MD General Medicine. He said, in fact, I would like to quote what he said. You're not confident on medicine, neither on your material medical nor in medicine. And he said, Boric is nothing but therapeutics. He's very right to say that. We got annoyed. Why? Because young blood, intern is the time. But he's very good. He says, our book says, high systolic and low diastolic. If you just go through the net, this is a situation where you see in aortic regurgitation is the other one, but in arteriosclerosis, this is a wonderful drug, Bariatamur, right? Apart from this, it has some gastric complaints. Bellispernis, right? Just like your arnica, Bellispernis, we give many of them as give routinely these drugs, right? Where there is excessive physical work, right? Where it could be agriculture or it could be a laborer, right? All this, or internal surgeries, especially the soreness of the internal organs, or Bellispernis does wonders. And there is a word here you can see a train accident, right? It is called as railway spine. What is this railway spine? Many thought it is concussion of the spine. No. Along with the concussion, many of the people who are met with an accident develop psychiatric symptoms. And that they call it as railway spine. It's not mere injury to the spine or concussion, because concussion of the spinal cord is very, very rare. It doesn't happen that quickly. And their doctors, they did find that what they have extensively studied these people, and they found that there is no lesion in the spinal cord. At these patients of the accidents, they were coming out with psychiatric problems. Let it be depression, let it be mood disorders, etc. And they named it as railway spine. So Bellispernis is a very good drug, especially after an injury, right? And apart from that, varicose veins, etc. Armour natronatum. This has given me a lot of patients. How? Homeopathy is always a chain case, patient to patient. Very few come to us while seeing the board. If I cure one, he brings other one. He brings some more, he brings some more in that way. So that is the reason I always advise my younger doctors who are here. treat the individual case very carefully in the beginning so that you get more clientele. If you lose one case, you'll be losing the chain. So in the same way, here Armour Natronatum brought me many patients. And the indications are fibroid uterus, a very good drug, excellent. If you know this fibroid, your calcarea carb is there, calcarea floor is there, Thalapsy pastor is Fraxinus americanus, and Armour Natronatum is another excellent drug for fibroid uterus. I give it in tituration 6x, and also for PCOD or PCOS, Armour Natronatum. Apart from that, boric acid is a good drug for psoriasis, etc. But you can take this drug. Calotropis. Here in Hyderabad or Telangana, every intermittent fever, first we think of malaria. But in Rayalaseema, I worked for 6 months as an intern in Gudur belt. Their intermittent fever is known as filaria. Filariasis, first is filariasis. And there we used to give Calotropis 6. And we gave excellent results for filarial cases, right? So elephantiasis and Hansen's is Calotropis. Cascara sagrada, I have a very rich experience where there is no cause for constipation. So it can be given as palliative for constipation, and also rheumatism associated with constipation, we have Cascara sagrada. Carcinosin, you all know. This is a drug which is extensively represented in synthesis repertory. Every drug, every rubric has carcinosin in it, right? And we all know it is a drug to be given with a family history of cancer or symptoms of the disease itself. You can give with confidence, right? And it is fastidious more than arsenicum album. And it's a very good drug for ADHD, autism spectral disorders. You can bank on carcinosin, right? Syphilandra, you all know. We just, especially it is indicated for loss of weight. Loss of weight. In diabetes, we give Syphilandra indica. Crotalus har, these snake poisons are very, very important drugs to control hemorrhages and also to dissolve clots. Let it be Crotalus horridus, let it be Bothrops lanceolatus, Lachesis, Vipera, etc. They have action on vascular system. And in Crotalus horridus, in fact, we give for HIV in our hospital. A research wing is going on and it's giving very encouraging results. Crotalus horridus for HIV. Right, thank you. Hemorrhages are slow oozing, thin blood, not clotted. In fact, I would like to tell one case. One of my colleagues' mother had a cerebrovascular accident. She fell down in the bathroom and she didn't come out. And after half an hour, 1 hour, as she's not outside, they went to see her and she was unconscious. Immediately she was shifted to hospital, Ashoda Hospital clock tower. Then we received a call. We went there around 11 o'clock in the night. Our colleague was agitated, emotional, and Dr. Praveen sir brought Crotalus horridus. So we wanted to give it on the tongue, and one by one we saw her, and Dr. Praveen was the last to enter. Why? Because they allowed only four or five people, and the Praveen sir was seeing where to add this medicine. He couldn't find any. So what he did, he rubbed the dilution in his hand and applied to the forehead. And after that, subsequently, she was discharged. 15 days, she went for a review. She climbed 2 floors. You see, she climbed 2 floors and doctor was stunned to see, are you the same person who had a stroke? That is the effectiveness of our homeopathy. That's the reason I would like to share this drug. Yes, especially in cerebrovascular accidents, immediately if you interfere, definitely there is a detriment. Now she attends every function. She's just quite like us. Absolutely don't see any problem with her, right? So this is the effectiveness of our drugs, and Protalix is one of the drug for cerebrovascular accidents, right? Other drugs we have Botrops, Laxis, Elapse, etc. Cannabis sativa, I have seen one case of cannabis sativa where asthma better by standing. My senior practitioners might agree with this. Why? Because we all come across one day or other the rubrics of our Medica. I would like to recall what I used to say as a final year student. All these symptoms, what you read in Medica won't come. But very recently, that is 6 months back, one patient came to me and said, "Sir, I have a sensation as if my skull is opening and shutting." Where do you find that? We find in cannabis indica. I was stunned to see. Immediately, very next day, I told my students. So that is the reason. What all you read is there in your Medica. One time or other, we come across our seniors. Definitely, they agree, right? So cannabis is another rare drug, especially for asthma. Better on leaning against the wall, and it has its problems of the urethra, where it is very, very sensitive. Equisetum, not only for urethritis, but is a drug we give for nocturnal enuresis. Nocturnal enuresis, please. A principal action on bladder, incontinence in children with dreams of nightmares. This is a characteristic feature. If you ask the child, what is the reason, he may tell that he might have seen some ghosts or dreadful scenes, which is causing, this is the indication of equisetum, right? Along with it, there is involuntary stool. Hecla lava is another drug we all know. It action on exhastosis, osteomyelitis, right, jaw, etc. But there is one more indication of Hecla lava. This is it. Facial neuralgia from caries, teeth, or tooth extraction. If you recall, the maxillary and mandibular divisions of the trigeminal nerve are irritated, especially in caries tooth and tooth extraction. I have come across one case where I have given Hecla lava. It is very nicely written in our Boric, where it is said that facial neuralgia from caries tooth and after tooth extraction. Illicum is for infantile colic. As you see, you might have heard the Gripe water advertisement, where an infant is given this for digestive problems. We can bank on Illicum and micromedia. Micromedia is another drug which has infantile colic, and I found both of them very effective in this. So we do in pediatric practice come across these cases once in a while, and we advise the parents to give this drug. Juniperus. A drug which is there in Boric, a drug for chronic kidney disease, where we have seen creatinine levels of 5, 6, and 7 coming down effectively with the Juniperus communis. I give in mother tincture. Mother tincture, please. Juniperus communis, very effective for CKD, along with Punarnava. Bohirvia diffusa, Punarnava, mother tincture. This bring down serum creatinine levels to a large extent. So CKD and other kidney disease related diseases, you can bank on Juniperus. Raphanus sativus. This is another drug which has shown interest in me. We came to know this drug when, again through Ramana Rao, Dr. Ramana Rao Garu, not our Ramana Rao Garu, who recently passed away from faculty. He is MD General Medicine, Ramana Rao Garu. So my friend was attending Santosh Nagar nursing home, where during his interview, and one patient has underwent cesarean section, and there was paralytical ileus. That is, the intestinal motility is, what do we call it as, there is no intestinal motility due to anesthesia effect. And normally it should not last beyond 72 hours. But here what happened? The whole abdomen was distended. Doctors were worried. After 3 days, there is no movement of the flatus up or down. Gas is not going up and down. And this doctor has given Rafanus. With that, I have given this Rafanus to not less than 3 or 4 cases. One is our Dr. Hari sir, you may be knowing him, right? Excellent results. And in fact, if you go through the Boric Metric Medica, it says post-operative gas pains. And you see a nice word, distended tympanic heart, no flatus is emitted upward or downward. One case after cesarean I have given, another case after nephrectomy, due to cancer, kidney was removed and it was not passing. He had paralytic ileus. Usually within 3 days, motility has to start. It's not there. And I have given Rafanus sativus. And that particular gentleman didn't call me to acknowledge. Again, after 4 or 5 days, again he called me and asking me the same medicine. So this what I have given is Rafanus sativus. You also try it. It gives excellent results with confidence, right? It works. What is the common name of this one? It is radish. Radish. Rafanus sativus. Asclepius tuberosa. I was working under Dr. Rohini ma'am in our hospital college. She was HOD medicine. I was her assistant. A case was admitted in our unit, had pleurisy. There was a rub, pleural rub. And madam wants to give Bryonia. I said, ma'am, let me, because she was very liberal. She likes me very much because I was her student. Later on, I became her colleague. I had given Asclepius tuberosa, and within 1 day, the patient was absolutely normal. And what is the common name for this? Pleurisy root. The common name for Asclepius tuberosa is pleurisy root. So it's not only a drug for pleurisy, but is an excellent drug for pleurodynia. It is known as butterfly weed. You see a butterfly there? It's known as butterfly weed. Why? Because due to this brightness of the flowers, the butterflies, they sit on that. So it causes pleurodynia as well as action on respiration system, especially pleurisy, that is Asclepius tuberosa. In fact, I give you this, then if it fails only, I go over for Bryonia, Calicarp, etc. But straight away I give you this Asclepius tuberosa. There are no other symptoms. Ambrosia. Nowadays we are hearing this name for beauty parlors, isn't it? Yes. Other name for this. This is our plant, but ambrosia is a name I have seen for these beauty parlors, designer studios, etc. What for it is indicated? It is indicated for hay fever, allergic rhinitis, and it has given excellent results for you. With confidence, you can give it. What for? What are the indications? Intolerable itching of eyelids. That's it. No other symptom. Only thing is rubbing. You can bank on ambrosia. You have your arceodes, etc. But definitely, this is the indication, especially lacrimation, intolerable itching of the eyelids is the indication for ambrosia, and I've given in many cases of this. Okay. Same way, arundo. Any idea, please? Allergic rhinitis with itching of the soft palate. We also at one time or other had this feeling, and you feel like scratching. We can't do it. What we do? In this way, we'll be doing it. In this way. So the drug is arundo. In fact, I would like to quote what a senior practitioner from Eluru, he said, what you are seeing is nothing but materia medica. Whatever the patient speaks is materia medica, only thing you have to match. If the patient comes to you and says, I have itching there, you see, then it's arundo, that's it. Itching of the soft palate with sneezing, and this has given me very good results. Arundo. Hay fever begins with burning and itching of the palate. And apart from that, itching of the nostrils and the roof of the mouth. You have the same symptomatology in Wyetia also. Wyetia, W-Y-E-T-H-I-A. But it has not only this region, but it has pharyngitis, sore throat. But here it is limited to the nose. You can bank on Arundo, right? Sarcolactic acid. Now I'm not going alphabetical way. Now I'm going to the experiences. I would like to share them. Sarcolactic acid. Acids, think of weakness. And this is a very good drug. If you go to the Boric, he says prostration after viral fevers. Prostration after viral fevers. And this I have applied for COVID patients, second stage of COVID, second phase. Many of the patients who had COVID had prostration. My father-in-law and mother-in-law had COVID. My wife is the only child, so she has to be with them. She got COVID. Me, my kids were in my house, and she did their own. And when the COVID has come down, she comes. Absolute weakness. She stood and she fell. Not much weakness of that. First time I had sarcoidotic as it was happened. Within overnight, later on, I give it to my faculty members who are down with COVID. It removes weakness of COVID, please. Yes, you can give it with confidence. Sarcolactic acid I given in 200 potency in COVID patients. If you read the Boric, you have epidemic influenza, epilepsy with violent retching and great prostration when arsenic has, especially when arsenic has failed. But please, nowadays, COVID is not showing that much, isn't it? What it has shown, its impact on second phase. But if the patients do develop weakness, you just give sarcolactic acid and see. Allium cepa, you all know allium cepa, isn't it? It is for coryza. But there is another peculiar symptom of alien cepa. What is it? We purchase shoes. Nice apples, nice shoes, right? Right? We wear them. What happens? Shoe bite. What does it do? What does it mean? Allium cepa is for shoe bite. That means allium cepa don't bite there. Due to the friction, there are blisters, and allium cepa is the drug for that. For shoe bite. Apart from your neuralgic pain in the amputated or phantom limb, is a very good drug for shoe bite. You give it and see the action of it. Very good results you can get. Allium cepa is that. Right? Lecithin. Lecithin is a drug prepared from yolk. Majority of it is prepared from egg yolk. It is a nutritional remedy, I say, along with your calcarea phos, your 5-phos, right? Alfalfa. This is a wonderful drug, right? But the indication for this is, you see, it is increasing the number of red blood cells and amount of hemoglobin. It sees that the hemoglobin is normally synthesized. You may ask, you may be wondering how. There is no role of homeopathy in nutritionally deficient disorders. Please remember that. If your diet is not rich in the nutrition, then our drug doesn't do anything. But your diet is rich in nutrition. But if it is not properly absorbed, our remedies have a role to play there. So that's what I always tell. There is no role of homeopathy in nutritionally deficient disorders. No, you have to provide nutrition in the form of, let it be protein, or let it be carbohydrate, or let it be the vitamins. Supplementation is a must. How? Advise the diet or advise the fruits which are rich in this. But everything is normal, but still the person is having this. You can bank on lecithin is one of the drugs where you have increasing the number of red blood corpuscles and amount of hemoglobin. And one more indication I'm finding it very, very effective is excellent galactogog renders milk more nourishing and increasing the quantity. I give it in 6x. Many patients do come to us. They say, sir, I'm unable to, or I'm unable to feed my child, or the milk is not sufficient. You have your lecithin there. Lecithin there. You confidently give lecithin, definitely there is improvement. If you recall, yes, there are resinous communists is there, as phytodie is there, these are routine drugs we give. Lac defloratum is there, right? But these drugs, along with it in 6X, you can give this, right? That is egg yolk, fragaria. These are the drugs which I had experience. In fact, I'm really thankful to my teacher who taught me these drugs also. Right? Fragaria. What for? It is action on teeth, dental plaque, prevents formation of calculi and removes tartar from teeth. I give in 30th potency fragaria. Many a times patient do tell us, sir, I brush. After some time again, I feel my teeth are oily. A slimy feeling you get. There are two drugs in our Metromedica, wonderful drugs. One is fragaria and the other drug is calcarea renalis. Calcarea renalis. I give with confidence these drugs. Where do you find calcarea renalis in Broric? You find this in relationships of calcarea phos. You just go home and read the book in the Boric. Calcarea phos relationship, you have calcarea renalis there, where it is said that lessen the tendency of accumulation of tartar on teeth. Low potencies I give, the rare drugs usually I give low potencies. Definitely they. Iris tenax, you all know, right? In fact, we say that there is no specific for homeopathy, that is it. But this is the only drug which says only one drug. Appendicitis, you have iris tenax there. But there is one more symptom which is I found it and I've given one of my what we call it as subordinate staff working in pharmacy. Her child had dry eyes and dry mouth, that is Sjogren's syndrome. Sjogren's, Sjogren's syndrome. And she was brought to me. Her eyes were absolutely red, and there was no saliva. Mouth is dry. And after giving iris tenax, there was improvement. Right? Maybe she is still attached to her palate. Right? You can ask her. Okay, tomorrow. So has absence of saliva in the dry mouth, like muscata, and eyes burn and are devoid of tears. This is an indication for Sjogren's is an autoimmune disease. Yes, you can give, or you can try iris tenax. Calmia, many knowing it. Apart from heart, it is cervicobrachial neuralgia, right side. Cervicobrachial neuralgia, where there is some severe pain in the right hand with numbness. You can think of Calmia latifolia. CBN, I said, cervicobrachial neuralgia, apart from the heart. Iris versicolor. If anyone asks any drug for diarrhea, you say aloes, on phone. In the same way, this drug is for migraine. Migraine. You see a peculiarity. It fits into the classical migraine. It has blurring of vision. It has one side right, one side left, etc. And it has one peculiarity is headaches on relaxation for teachers on Sundays and preachers on Mondays. Teachers is not weak. In government hall, I'm talking about the teachers who teach till high school, especially private teachers. They literally slog 6 hours a day, 6 hours a day for almost full month, right? So, okay, right. So it fits into migraine, and it is said that headaches on relaxation for teachers on Sundays and preachers on Mondays. Apart from that, it is excellent drug for pancreatitis and hyperchlorohydria. Lepis alba, a duffy feeling, pindi muddalaga. I hope you follow Telugu. Pindi mudda, you touch it, a duffy feeling. It is a drug for lipoma. Fibrolipoma is the more appropriate. It is silicofluoride of calcium. So Lapis alba, I give in 30 potency, but I give it continuously, please. And especially on the hands, they dissolve. How do I know? They say, sir, earlier bangle was still. Now I'm having the bangle. It's moving over the swelling or over the lump. You can bank on Lapis alba. Right? Once look at this, Naja is our cobra. Right? What is that we come across? We think that is a good drug for heart. But there is first line of your boric says something. In fact, I've referred a case from I hail from Satupalli, Khammam district. Advocate friend from there has referred one case where this person was unable to swallow anything solid or liquid, and there was nasal regurgitation of the fluid. And being a friend of mine, he said, yes, my doctor is there, you go here. That fellow, he was brought in a car with high expectations. And I asked him to stay in Hyderabad for 1 week. And as luckily relatives are there, he was there. Then I was going through Medica and I found that bulbar paralysis, a word used in Naja, first line is bulbar paralysis. This patient was emaciated. He was brought to me literally with a nasal tube, nasogastric tube, where the feeding was done parenterally. Sorry, through this tube, right? So he was very lean, he has become lean. And it said bulbar paralysis. What is the bulbar paralysis? The bulbar muscles, that means the muscles used for deglutition are bulbar muscles. And the nerves which are used for bulbar muscles are known as bulbar nerves. They are 9th and 10th nerve. And once the 9th and 10th nerve is affected, there will be nasal regurgitation fluid. Please, it's not exaggeration, it's a fact. I have given Najat 200 to this patient. And after some time, I got a call that there was an improvement. And he started eating morsels of food. The tube was removed, he was eating morsels. Avakaya pachadu, palleturu ade kadama, gatti avukam, chadanam. That he was eating, absolutely regained his weight. That is the greatness of our homeopathy, right? So Naja, you have it here. This is what, apart from your cardiac, physostigma, it fits into glaucoma, night blindness, and musca volitantis. What is this musca volitantis? You ask any software people, they say, they call it as floaters. They call it as floaters. You also see and you move your eyes like this. You'll feel that, especially of my age. Right? You feel that some objects are floating, black objects like this. They are called as floaters. They are nothing but the substance which are seen in the vitreous humor. You have 3 drugs for this, excellently working. One is phytostigma. The second is dubiosine, dubiosia. And the third is senaga. Senaga, it is rightly said, it absorbs the fragments of lens after operation. In boric, clear writing was there. Senaga absorbs the fragments of lens after operation. And I usually give this phytostigma and senaga. Senaga in mother tincture for this musca volitantis problem. Once you say senaga, we call it as for COPDs, lung problems, but this is another indication for senaga. Right? Rascalabra. These are the early days of my practice. I was attached to Ramakrishna Homeo Stores and Ramakrishna Research Center before entering to the service. I entered service in 92, passed out in 89. So this 1.5 year, 2 years, I was working in Ramakrishna Homeo Stores and Research Center. One day at Ramakrishna Homeo Stores, a patient has come to me of middle age, 45. He sat in front of me and he was crying. I asked, what is the reason? Sir, mine is a doctors, though you are very engaged, once you sit in the chair, you are respected. He addressed me. I was in. He said to me, sir, I have a problem. What is the problem? Dharanamaina problem. I don't know whether you know Telugu or not. It's Dharanamaina problem or not. What is this? Sir, a number of times I go through the fresh room. I pass tools, but whenever I pass my flatters, it is offensive. And the stage has come to such a way that whenever the meeting is going on, if anyone does something, my boss is asking me to stand up and get out. Such a humiliating thing, isn't it? Such a humiliating thing. And I have given this drug, that is Rasglabra. Rasglabra. Even today also, you might have heard from your, at times I'll be going to the Telugu also. When a company champesad, he goes to the fresh room, but still he passes the flatters, it is offensive. And you have a drug there. Give this drug in 30 or 200 potency, you get result. And you see, it is for offensive flatters. Now you see what the Boric says. It is claimed that the remedy will be so disinfect the bowels that the flatters in the stools will be free from odor. I have seen this drug doing wonders. Doing wonders. Rasglabra. Next visit after 15 days, he came to me and he was very thankful. He was happy. Right. You see how humiliating effect it was. Right. So definitely, yes, we have this drug you can give. The drug is Rasglabra. Cadmium sulf. Once you look at this cadmium sulfate as an action on various things, but I found my experience very good drug for corneal opacity, and especially effects after chemotherapy and radiation, please. One of the people who are on chemotherapy or radiation, they get severe vomitings. Give a dose of cadmium sulf. That is finished, removed. Very recently, 3 or 4 days back, I gave cadmium sulf to a patient. Absolute relief, right? So radiation and chemotherapy and action on cornea. This is cadmium sulf. There's another drug, cadmium phos. It is also a good drug for bad effects or after effects of radiation and chemotherapy. Here I would like to share, I don't know whether I have put X-ray in it. X-ray. One of my students was asking, sir, why not X-ray? X-ray has its own sphere of action. And I found very effective for photosensitive dermatitis. Photosensitive dermatitis where the face becomes black on exposure to sun. One of my teachers had this problem when I was a student. Then I went to Madanapalli. That was my first posting as medical officer. Then I came back to the college. The same faculty was there. He was there. His face was absolutely normal. Then I asked him, sir, what is the drug you have used? He said, X-ray. Once you get such kind of things, grab it with both the hands. And I have given X-ray for a number of cases of photosensitive dermatitis, where no other indicated drug is there. It is excellent. One patient still comes to my OP. Her face was black. Now, the PG who is doing on X-ray has taken photos of her also. Right? And now I always say her, go and participate in Fair and Lovely advertisement. Absolutely normal. Absolutely normal. I'm not exaggerating, it's a fact. Right? So that is X-ray. You also do, because try and remedy, it gives excellent remedy. So in the same way, you have cadmium sulf. Lactuca virosa. When a doctor says that I know everything, he ceases to be a doctor, please. Remember this. We learn from our mistakes. We learn from our success. We learn from our students. We learn from our peers. We learn from our seniors. And I learned this drug from a gynecologist. I learned this drug from a gynecologist. One patient came to me, sir, you have a drug. Then I said, no, I didn't know this drug. There's no need that I know all the 3,000 drugs. Then she, sir, she recommends the drug for lactation. Then immediately I refer the boric, it is rightly there. Lactocavirosa in 30 potency. It's a very good drug for lactation. These are other indications, but the indication seems to be true galactogogue. True galactogogue. You have lactocavirosa. Once you know it, just start giving it. That's it. That's what I've been doing. I'm doing now. Medusa. What is this medusa? Jellyfish. You all know how poisonous it is, but it brings smile to the mother. It brings a very big smile to the mother. Now let us see how. Marked action on lacteal glands. Secretion of milk was established after lack of it in all previous confinements. You see how nicely it is done. This is medusa and a given mother tincture. Patient do tell us, sir, earlier confinements, no, I didn't. Is there any medicine? You have a medicine here, that is medusa. I have seen Dr. Sita Ramaya Garu, a senior most practitioner. He was attached to Ramakrishna Mission during my time there. I don't know whether he's there or not. Sita Ramaya Garu from Ramakrishna. Alan. Those were the days we fought, young blood, like him, interning. We fought with the superintendent. Why? He didn't allow us, a group of us, to go to Gudur. One doctor, we heard that he teaches homeopathy very nicely. Then we fought, students, we fought, and we took one senior faculty member. At last, our request was, okay, we went there. We used to be there at 8:30, and sir used to come at 9:15. And we were there sitting around the table, making arrangements because the OP was huge, 100 plus every day. Then part-time sweepers were there in the dispensaries. She was sweeping the floor, suddenly the broomstick fell from the hand. We called her auntie, isn't it? We are just like it. Then we made her sit on the stool, checked her BP. It was 240 by 140. Me, Rajesh Rao, our colleague faculty, we are all there. We didn't know what to do. And just that sir walked in. We told him, sir, this is the thing. He said, give adrenaline 30. We are given adrenaline 30. After few seconds, BP was 180 by 100. The CVA was aborted. She was going for CVA, cerebrovascular accident, stroke. That was aborted by adrenaline 30. Once you know this, then you don't leave it. Right? That one we have dispatched her, sent her to another hospital to follow up. That's a different thing. But at least homeopathy do work in emergencies, do work very, very quickly, provided it is indicated. Provided, otherwise you give a bucket of the drug also, it doesn't do anything. No. When I say bucket, not literally bucket, 1 M10, M50, MCM, no. If it is indicated, it acts. I've seen cases of 103, 104 coming down very, very nicely within few hours. Gastroenteritis within 2 to 3 hours we can cure. Right? Better than allopus. But again, the same dictum goes, provided it is indicated. Right? So adrenal has an action. What is the action? It is sympathetic action, vasoconstrictor. Once the peripheral blood vessels are constricted, we all know that there is hypertension. I think for her, there could be an emotional disturbance at home. We are not aware. Somehow she landed in this, right? And she had this problem. So this is a very good drug for severe hypertension. You can say malignant hypertension, where the blood pressure suddenly shoots above the normalcy. Adrenaline is a drug. Agraphis nutans, a drug for adenoids. but the only indication is adenoids for impaired hearing. Impaired hearing. Argentum metallicum. I did my MD dissertation. My topic is osteoarthritis. During these 3 years of study, patients literally were brought to me through autos, took leave, stayed at home with homeopathy. They joined the profession and they started working. And one of the drug is Argentum metallicum. What is the indication? The only, if you recall Argentum metallicum, you know that it acts on laryngitis, chronic laryngitis, like your RM triphylinum argentum, this thing. But if you go through the first para of boric is very, very important. It says it's an action on cartilage. It has action on cartilage. And the indication for Argentum metallicum is joint pains coming down the stairs. I extensively use 6x potency. I have almost LBs of Argentum metallicum in my clinic. LBs. I give it a wonderful result. In fact, the patient was brought to me, one particular patient, works as a mechanic in Bodupal, RTC bus depot, Uppal depot. He was with me. He's a mechanic. Mechanic means he literally has to sit squat on the floor. He rejoined the depot as a mechanic and worked. That is the greatness of homeopathy. And drug for him is Argentum metallicum. And my study has shown X-rays before and after. Took them to a radiologist. He said, "Doctor, you have done an excellent result." Yes, there was gap also increased. These are the words I'm quoting him. But sorry, I don't comment on my pay. Why? Because we all know that osteoarthritis is a progressive disease. There is no cure. If I say that there is cure or there is reversal, I'll be barred from radiology bar or association. And sir, what is you? I'll give one thing. He says, what is that? I'll say that within these 3 years, there is no further deterioration of symptoms. This is the thing he has given me. He appreciated my work, but didn't comment on why, because I had to give a lot of explanation to my friend radiologist. What he said he has given me, yes, there is no further deterioration in 3 years of study. At least give me, sir, that. He has given me. Our drugs do wonders. There is a right time. I would like to quote Dr. Janardhan Reddy sir's brother, Venkat Reddy sir. He passed away. He's an HRD department, orthopedics, Usmania Hospital. He says, if you homeopaths start treating orthopedic cases, we have to shut down our shutters. These are the words he has used. These are the words he has used. Excellent work. Okay. So Argentum metallicum, a very good drug for not only for chronic laryngitis, but cartilage in OA, especially aggravated descending the stairs. Ascending the stairs, we have two important drugs. One is Badiaga and Calcareca. Right? And urine is sweet odor. This is another snake poison. And this drug has won laurels in a factory which is very near to me, Associated Glass Industries, glass factory, we say. One patient, family had, these are my patients. This gentleman had a stroke. Being a private company, he was shunted out. I went there, saw him. He had CVA, was unable to speak. Hemiplegia with aphasia. We all know it is Broca's area which is affected. And the drug I have given is Bothrops. And the man attended the office again. Just like Crotalus Har. What happened to my colleague's mother, actually, it has done. This is one case I have given. Another experience, what I would like to share is hemiplegia. This is at Broca's area, hemiplegia. Then one of my students met with an accident, road traffic accident. She went into coma. And doctor at NIMS, he said, there is extensive axonal injury. Homeopathy cannot do, no, she cannot survive. I don't remember that dog, but he's a friend of Dr. Praveen. Then we have given, why? Because extensive hemorrhages were there. We have given both drops, right? You can inquire Praveen sir also. Me and Praveen sir gave a letter. I joined the team. We have given, and that particular doctor said, "Kya kamal kar diya homeopathy ne." These are the words he has used. And the student joined the college. I was the examiner for her in third year. Answered better than the regular students. There is no regeneration of thing in brain. We all know. And that gentleman, I don't remember, starts with P. He's a neurologist, HOD, neurologist. He said she'll be a living vegetable. One thing I learned from my senior, Dr. Praveen Garu, I always take him, he's one of my mentors. He says, if one drug is, if you feel that it's indicated, give 30, not. Give 200, not. Give 1M, not. 10M, 50M, anywhere it will act. Our drugs, why we fail? Susceptibility. The drug should match in similarity as well as potency place. This is what I learned from my senior. Right? Students, those who are hearing and also hear. Right? You may find a Rustux is indicated, it's not working. No, it is Rustux, but it may require a higher potency. Give 1M, not working, 10M, it works. So please, if you are very sure, just increase it. That's what I learned from my senior, and I do in my practice. That's what I say. We learn from everyone. If your doctor says, I know everything, I'm no more a doctor, please. I'm not a doctor. Right? There's an extensive axonal injury. This is that. And the doctor, neurologist, HOD, I don't remember his name, he said, Kya kamal kar diya homeopathy. And she joined and I was the examiner. And she's in Nellore. Once in a while, she calls me and says, hi, sir, how are you? Right? That is the greatness of homeopathy. And one more drug, both drops is, what I try to apply is, I try to apply these in a general way also. For one case of pulmonary thromboembolism in our hospital, I have given that emboli got dissolved. She had this recurrent, she has DVT, deep vein thrombosis. One of the complications is once I dislodge lungs. The first target organ to be affected from the emboli of the DVT is lungs. And I have given both routes for this case with an excellent result. Right? Caladium. You all know it's a male remedy. Let's not go into that thing. But there's one more indication of this caladium. What is that? Parents bring us, Sar doma kuttindante, viparitma durda and black spots. That is it, what we have. Insect bites, mosquito bites, itches intensely and leaves black spots. You have caladium there. Many give epis, but you give this, it is there. This is action of caladium. Carbo animalis. I'm not going to the whole picture, only peculiar thing which I came across. Eruptions after shaving. Eruptions after shaving. Only one drug in our repertory, that is Carbo animalis. Much stuff. Can I continue? Right. That is Carbo animalis. And also acne indurata, which disfigures the face. Big ones. Ultimately, after that, the pits are there. When I say pits, there's one more drug in our material that is called sarcenia. Sarcenia. It fills up the pits of smallpox. It says, why not acne? You give for that also. Right? Chelidonium, you know, liver remedy. But in my study, I have given chelidonium for joint. My teacher, my guide was Dr. Sohan Singh, sir. He has given absolute liberty. Those 3 years I was managing the whole IP. He was superintendent of the hospital, he was given me. And one case I was treating, the patient, what he had is joint pain, severe joint pain, and slightest movement aggravation. What you give? Bryonia. Bryonia, all concur, all didn't work. Ledempol, didn't work. Then one day I went to the hospital, the patient was not on the bed. Then where is he? Gudichuttu, there is a temple in our campus. He is going around the temple. Within one night, please. I'm not exact. This is the effect of homeopathy. Then I left, literally went to him. I was in service that time only, always also in service. He said, one of the doctor who is very short, but again, I don't remember his name. I don't find a drug, huh? Forget the names, okay? Right. What is the drug? Forget the names? Don't give the drug to me. Right. So what happened? He said, sir, that short doctor is there, he has given. I went to him. What is the drug? He said, chelidonium. Yes, that time also I started giving chelidonium. I started introducing chelidonium in 2002. Till that time, I didn't know that chelidonium is for joints. And what is the indication? Burning pain in the joints. Only one drug, first drug in repertory. Highest grade is chelidonium. Chelidonium has, just like bryonia, slightest movement aggravation. We have chelidonium, colchicum, ledampol, and bryonia. First grade drugs, aggravation by least movement. And one more addition is chelidonium, burning pain. If you have, the patient says, I have a lot of burning, close your eyes and give chelidonium. Didn't work, raise the power. Didn't work, raise the power. That's it. But definitely it holds. Cardus muriens. We know it is a drug for portal hypertension, liver. But there is one more indication of cardus muriens. I give it for dyslipidemia. Dyslipidemia, where they give statins. Statins have side effects. They also admit, but there is no gear. They give statins. I give cardus muriens along with Allium ursinum. Allium ursinum, not Allium sativum. That's why garlic family. Allium ursinum. I have seen LDL of 130, 140 coming down to normalcy. You also, it could be your brothers, cousins, uncles, aunts. Give it and see. Cardus muriens, especially, and Allium ursinum in mother tincture. 5 drops of that and 5 drops of this. Just it's a practical. Don't ask me how, but this is what I learned. I advise you. Okay, all right. That's what I told you in the very beginning. I learned many things from my seniors. You see that dyslipidemia, excellent drug. There's no need to go for statins, please. There's no, I can say I cured more than 50 cases of this. You can also definitely say, yes, this drug wonders. Dyslipidemia, cardus muriens, and Allium ursinum. Macrotinum. Thanks to my teacher who taught me these drugs in Gudur. Macrotinum is a extract of Simsifuga. It is an extract. If you go to the boric, last line of the Simsifuga, you have macrotinum for lumbago. We had a great teacher of Medica from Orissa as an examiner. Once he comes, our Medica students, sir, you're also Medica philosophy, yeah. And he used to tell me the 13th line of so-and-so drug, tell me the 4th line of boric and so-and-so drug. His practice is night 2 or 3 o'clock. I also at times do this, last line of the drug. Okay. And macrotinum is a very good drug for lumbago. In 6x I give, especially when a case of PIVD comes to me, prolapsed intervertebral disc, let it be lumbar or let it be cervical. This is a drug which is there to the patients. I've seen cases of PIVD with foot drop, one case coming back to normalcy. Patients have their own network. He hails from Hanuman Junction. He was brought to me. Why? Because one of his cousin was here. Incidentally happened to be my son's friend's father. So he brought him. Can you do it? I did, worked. And he referred the cases from Rajahmundry, from Visakhapatnam, from Nelu. I don't know how this network is. Tomorrow you will also see. And the seniors definitely agree the network. We don't know. They'll be referring the cases. Cases are referred. And PID cases, we can do wonders. And one of the drug is macrotin 6X. The indication is better by pressure. Better by pressure. Especially for lumbago. Cobaltum. Cervical spondylosis, especially pain in the neck, especially bending the neck forward, is cobaltum. Cratagus. You know, it's a great heart remedy. Cratagus, cactus, convoluria, adonis, all cardiac remedies. But boric, first para, third line or fourth line, he says it has a solvent power on crustaceous and calcareous deposits in the arteries. How nicely, way back in 1905, where medical science has not advanced to that match, he has very nicely written that Cratagus has a action on arteries, and it has action to dissolve, solvent power to dissolve crustaceous and calcareous. What is the crustaceous and calcareous? Arteriosclerosis or atherosclerosis. I was discussing this drug, and one of my PG was there, first pediatric PG. She was slowly telling, sir, this is the drug one of the doctors in Nagpur gives, Dr. Chintanwala. Wherever he goes, he has presented where the blocks were dissolved. And she was telling, I worked with him, sir, and he has shown, he gives this Cratagus. You can also give. Cratagus dissolves. Wherever he goes, Chintanwala, he has a 2-story apartment. The first I can say private homeopathic hospital where cardiac cases, of course, allopathic doctor might be there to help, but he gives homeopathic drugs also. And he has shown before and after treatment where the clots have disappeared, blocks were cleared. And it, according to her, this is the important drug, Cratagus, right? Felthari. You can, should I continue? All right. Okay. Felthari. When I say cholesterol, you know it. What for? When I say cholesterol, it is for gallstones. Felthari is a very good drug for gallstones. I have seen cases where stones disappeared, please. Today morning when cases come, gallbladder polyp disappeared. I asked the patient to send it. The report is here with me. Gallbladder polyp has disappeared, dissolved. What I generally try to do is I try to apply a little bit more. Set the action on biliary calculi. Let me do it. This is coming from the gallbladder. Let me try this. The drug I have given is Felthari. And the report, tomorrow I'm going to show this to my UG students. Right? Polyp itself has disappeared with our homeopathy. And I've seen gallstones along with cholesterol. Chionanthus is another drug for gallstones. Lycopodium, calcare carb in 30 potencies, China in 30 potencies, right? No, when I say that, I don't give all the drugs at one time, but indicated, right? But this will be there, Felthari. For a metallicum, a rare indication. Again, thanks to my guide who asked me to take OA. What is the indication? A joint pain patient comes and squats on the floor, absolutely is happy there. Only one drug in our Medica, joint pain better by flexing. That is nothing but Ferromat. That is Ferrometallicum. It has this physiological vertigo where vertigo on seeing the flowing water. Apart from that, this is the indication I found very, very useful. OA better by flexing. For the indication of Ferrometallicum. Formica rubifa is again another drug which I use. It is just like bryonia, but the patient is chilly. Better by aggravation by movement, better by pressure, but the patient is chilly is Formica rubifa. For again osteoarthritis, I have given this with wonderful results. Fraxinus americanus, bulky uterus, fibroid uterus, especially fibroid, you have Thalapsi bursa pastoris, Armour natronatum, In the first slide, so second slide, we have seen calcare car, calcare floor, and fraxinus, another drug which I give in mother tincture. I tell you the potency what I use in lower potency, especially these rare drugs, and given in mother tincture with wonderful result. Fraxinus americanus. Gentiana lutea. A common symptom. A common symptom, parent brings a child. వీడు తినడండి. కొన్ని లేస్ అన్న తింటాడా? లేస్ కూడా తినడు కొంతమంది. There is no appetite at all. Give some medicine to, and you have this drug in your boric metriamedica, right? A great homeopathic appetizer. That's it. A great homeopathic appetizer. You give this in 30 potency, definitely the child feels hungry. If the child yields less and says, "Bus, you have lycopodium there." Right? Easy satiety. Many times it so happens, you say that I'm not feeling hungry. Once you start eating, you eat and your mother says, you said that you don't have hunger, but you ate full meal. What is this? Appetite returns once you start eating. We have drugs. Only two drugs are there. One is China. Second is lycopodium. Appetite returns while eating. You have China and lycopodium. They are there in the repertory. And this is a great appetizer of our materia medica. Apart from this, you have Caraca papaya, again an appetizer. Granatum, anar, great appetizer. Alfalfa, a great appetizer. Right? But you try this in 30 potency, definitely there will be improvement. Grindalia for respiratory we give. But another action I found in sleep apnea. Sleep apnea. The patient sleeps nicely, but in the middle of the night he gets breathless. You may say it is P&D. Heart is normal. Somehow he goes into this. Sleep apnea, you have another drug is Sambucus nigra. You can think for this. One of our famous musician, I believe, died due to sleep apnea. Right. A great musician. Very recently passed away due to this. They purchase that app and they keep it. Sleep apnea for that. Right. So you have Grindalia and Sambucus for that. Lacananthus. It is for Rhineck. Rhineck. We all know this is for this. Especially when I say Rhineck, we have your Simsifiga, you have your Lacananthus, front runners. But there is one more indication. Suppose you are supposed to, you want to give a lecture and there is a lot of fear. What is that you do? You take a dose of this, Lacananthus. It gives courage to make a speech. This is the indication what you see in Buri. A courage we are not aware of. In fact, I was not going to this only know it. Some may know it, some may not, but those who knows it may be a revision, right? It gives a courage to make a speech. I remember I was talking the same way in 1995. I was addressing almost 100 medical officers. Dr. Aruna madam was there who recently passed away, right? She calls me brother. Why? Because she was 2 years senior to me while studying, and everyone used to ask, is he your brother? Right? And she said immediately, did you take this medicine while talking? It gives courage to make a speech, is Lacananthus, right? This is out and out, angina pectoris. Your sorbitrate, homeopathic sorbitrate you can say. Yes, angina. And MI also you can, right? It fits into this Latrodactylus mactans, angina pectoris. Classical picture, no other drug, you have it here. Cactus also is there, but you once you go through this, yes, you say it is yes. Liatris spicata. One book was presented to me by my internees. I was going through the book, I came across this drug, Liatris spicata. The book was Selective Remedy by Rai Bahadur Bishambar Das. Rai Bahadur Bishambar Das. There he said that Liatis picata is a very good drug for ascites, and I'm just quoting him. He says it throws out gallons of water. It throws out gallons of water, not like this, through urine. If it is through here or through that, I get dehydrated. But it is through. Luckily for me, one patient was there in our hospital. I don't know. Someone may remember Kashaya Vastram Kapkunevadu, like John Borgla Patti. I used to hear ascites. And Roni madam was there, I was faculty co. I asked, ma'am, I will give this medicine. And after giving like a Liatis picata, my tummy is larger than his. Absolutely gone, normalcy. That much way it is reduced. And Rai Bahadur rightly said it throws out gallons of water. So I give this before than apocynon. Right? Liatis picata for ascites, especially of gastric and renal origin. If it is cardiac, you can also bank on this, and terminally Arjuna. Terminally Arjuna is another homeopathic diuretics. This is a drug, definitely a diuretic. That's what I used to laugh with him. Aapka tummy dekho to mera tummy zyada hai. Every gone, we used to measure every day. The bad thing of we homeopaths are, when I say we don't record this, what we have done. Evidence proof should be there. Now younger generation are taking up, right? Please do that. I was confident this drug was working. I should have recorded the case. I didn't do it. Now what I say, yes, it is there. Some may believe, some may don't believe, but it's up to you. But it is a fact. Please, when a case comes to you, try to record it. Nowadays, people are recording and showing that. Wonderful. Do that. Now, onus is on you, young blood. Right? Ours is over. All right, another 5 or 10 years I may practice. After that, I fold this thing. But please record it. Evidence-based prescription definitely will be helpful for the younger generation. Merck dulcis. I've seen not less than half a dozen cases of this. What is the action? Glue ear. Have you heard this word? Glue ear, middle ear effusions, where the tympanic membrane becomes concave. If you put a light, it doesn't shine. Normally it should shine. Healthy tympanic membrane doesn't shine. And you do a study and they say that it is glue ear. The drug is Merck dulcis. My brother had this problem. Now he's in States. Right, I have given Merck dulcis. Another lawyer friend had this. And one more student, very recently, one of the patients has gave Merck dulcis and the patient is better. Hearing impaired after a bout of coryza and eustachian tube catarrh, there are two drugs are there. One is Merck dulcis and other is Calimore. Eustachian tube catarrh and glue ear is Merck dulcis. A common cold, you feel that your ear is stuck, yes or no? We all had cold one time or other. Very exception, he says that I don't have cold. Nowadays cold, we are all afraid. That's a different story. Once you have cold, what is happened? This is blocked, you don't know the smell, and this also is blocked. Take a dose of Calimore, this opens up. Calimore 6x, it opens up. And Merck dulcis is there. Right? Natron sulf. Somehow, I try to go beyond the pictures of the drug. Why? Because this was the thing which made me to go into this. You all know natron sulf is for asthma and also bad effects of head injury, and your Kent goes into pages about psychiatric problems after head injury. Right? Tanya madam, she was senior most shrewd prescriber, senior most faculty member, retired long back. One case was admitted in the hospital. That case was Brown-Sequard syndrome. What is Brown-Sequard syndrome? Hemisection of spinal cord. You see now, head injury is different. This is different. And first batch clinicals, I take my students to the bedside and teach. I have shown the Brown-Sequard syndrome symptoms. Wonderful. Second batch I took, improvement. Third, disappeared. No symptoms at all. Then I went to the drug, opened the case and said the drug was natron sulf. Natron sulf. I didn't ask madam, but what I thought is central nervous system consists of brain and spinal cord. After that cue, I started giving natron sulf even for spinal cord injuries with excellent results, please. That's what I say. You can also try it and see. Very recently, I'm trying one case where he went to a Bombay hospital for knee operation. During the process of, during the process of operation, this person had severe hypertension. There was a hemorrhage, extradural subarachnoid hemorrhage. Yeah, in between the left meninges, subarachnoid hemorrhage. And this clot has settled at this T1 level. And according to the patient, he says that he could feel something was going down the spine and there was paralysis of the lower limbs, paraplegia. My cousin brother's son's father-in-law, Ishwan, Mr. Sharma. It's a fault of the doctors there. They are given IV also without checking that it is hypertension. What happened? Bubble burst. And a subsequent MRI, they have removed, some operation was done at the cervical, lower cervical area, and the clot was removed. But the damage was done. That area has gone into necrosis. And what is the outcome of it? Bilateral. And the drug I have given is, first I have given both drops. Arnica I have given first, no change. Both drops, no result. Then I said, natron sulf. After giving natron sulf, toes are, and there was sensation here. You could feel that there was no thing. I went there and I checked it. There was no sensation. Now there was sensation. You see the mechanism. So central nervous system includes brain and spinal cord. This is the cue what I got from madam. I give natron sulf. And it did wonders. You can also try. Nicolam is another drug for cervical spondylosis where you have cracking of cervical vertebrae. In this way, you can hear the cervical vertebrae. And one more important point is cough. Obliged to sit up and hold the head, must put the arms and thighs on thighs when coughing. You get severe headache. Mother will be holding like this when the child is coughing. Otherwise, the child is desperate, becomes anxious, irritable. This is Nicolam. Oleum jacoris. Oleum jacoris. If you go through the Metrimetica, he says hair on unwanted parts. The two drugs are there in our Metrimetica. One is Oleum jacoris and other is Thuja. Only two drugs are there. Hair on unwanted parts, especially upper lips, ladies, upper lips, chin, etc. You can bank on Oleum jacoris. And also it is a nutritional remedy. Right? Paris quadrifolia. Cervicobrachial neuralgia left side. Many they give spigelia. But you give Paris quadrifolia where it is a radicular pain with numbness. Right side it is scalmia, left you have Paris quadrifolia. You don't know what to give. What is the drug you give? You don't know what to give in cervical spondylosis. Give a dose of Naxwamika, please. Dr. Ramaya Garu used to say, Chikadapalli Ramaya used to say that. Give a dose of Naxwamika for cervical. If you don't know what to give, we definitely. You know classical symptoms of stroke, classical symptoms of brain, we don't go. But Paris quadrifolia is CBN left side. I have given wonderful results. Polygonum punctatum. And there is one more drug, Senecio aureus. Senecio aureus. These are the drugs for amenorrhea in young girls. All reports are normal, that's it. All reports are normal. Amenorrhea, functional amenorrhea in young girls, this is the right word I should say. Functional amenorrhea in young girls is polygonum P and senecio aureus. Rhodium is another drug for cervical spondylosis we give, where stiff neck with pain in the deltoid area. Okay. Have you heard about this drug? The group here? Heard about this drug? Thiocinaminum. It is calcarea floor-like action. Calcarea floor-like action. It acts on strictures. And I give this drug for keloids. I already told you the factory which is very near to me is glass factory, where glass are made, bottles were made. The people, they are burned, they develop keloids and they come to me. With the thiocinaminum, these keloids, they just dissolve. That is the great action, Mentulu. Am I correct? Thiocinaminum? Fenugreek, I just go through. I think it's Mentulu. Yeah, it is this one. Okay. Great action to dissolve. And I give for keloids not as an internal, but I give it as an external. My doctor, Dr. V.V. Prasad, he had a very seasoned practitioner in Barkatpura. He passed away. So during those times, he used to see patients till 12 o'clock or 1 o'clock in the night. He taught me this drug. Our group, whoever teaches any homeopathy, we used to go to. Can you come at 11 o'clock? Yes, sir. We used to go be there. He said, thiocyanamnum works externally if it is applied with olive oil. So what I advise, the patient take thiocyanamnum 6x powder, put 2 or 3 drops of olive oil, make it a paste and apply over the keloid. Here and here also, keloid, these are the commonest areas. They keep the pen or they keep the chain, and this is the commonest area. You apply, you give thiocyanamnum and see, you got wonderful results. Had one patient, now also he is coming, he had 2 keloids here, just like corns, horns, not corns, horns. Itna bada. And he didn't marry. Why? Because he was ashamed. Now kaisa hai? Just like a nodule. Everything has disappeared. But of course, for 3 years I've been treating him. As there is result, he is coming to me. Thiocyanamnum is such an effect remedy. Excellent remedy for the cause. So it's calcarea floor in action. One case I given for stricture rectum. Post hemorrhoidectomy operation was done. Sorry, for fissurectomy was done. Later on, there was stricture. He couldn't pass. And this helped him a lot. Thiocyanamnum. Here I have given external. For keloids, sorry, internal. For keloids, I give external. Other things I give internally only. Scrophularia nodosa. There's a nice mention of this in Boric, 2nd line or 3rd line. Dissipates of breast tumors. This is the word he has said. Dissipates means pata puncture chestundi. I mean, blast the tumors. Dissipates the breast tumors. One case, this person has invasive ductal carcinoma of left breast, metastasis with lungs and vertebral column. I kept her on Scrophularia nodosa. Past 2 PET scans were normal, please. That is the thing. So that's what I'm doing. I don't limit here only. I'm just trying to go beyond this. Now, anywhere cancer, I'm giving Scrophularia nodosa. Today, one case has come. He has severe cancer, liver cancer, metastasis to lungs. I kept again Scrophularia there. This is my way of practice. You can also, if you like it, you follow, otherwise you can discard it. But the more, right? 2 PET scans were normal. She comes from Nellore. I'm not, they're all facts. They were normal. And she discontinued. She's very happy. The bone, the vertebra is calcified. The metastasis is calcified. The drug I have kept is Scrophularia nodosa. Sabal cerulata, what for we use? What for you we use? Prostate, wonderful. Yes, but there is one more indication. Anyone? Fantastic, fantastic. Parents bring the children. Sir, there is no expected growth. There is no expected growth in my child. What is that? The expected growth is mammary development. It is valuable for underdeveloped mammary glands. Underdeveloped mammary glands. And also shriveling of mammary glands. One case I'm treating now. She says she's happy now. She's shriveled. Again, now slowly it increasing after giving Sabal cerulata. Prostate, you know, everything, you know, but this is very, very valuable. You are very correct. It is a valuable remedy for underdeveloped mammary glands and also shriveled mammary glands or shriveling mammary glands. You can bank on Sabal cerulata. This I give for primary headaches. Scutalaria. I give scutalaria, Usnea barb, Chionanthus epifugus for primary headaches. For primary headache, when I say primary headaches, headaches which doesn't have any organic thing in the brain or lesion. Your migraine, your cluster headache, etc. They come over here in this class. Scutalaria and Chionanthus are excellent remedies for primary headache. I give in mother tincture form, please, where you get very good results. Scutalaria and Chionanthus, CHIO, not CEO. CEO is clinic remedy, whereas CHIO, a remedy for gallbladder, a remedy for gallstones, a remedy for chronic headaches, Scutalaria and etc. That is primary headaches, right? This already I told you, right? Not only for COPD, promotes absorption of fragments of lens after operation. Opacities of vitreous humor. You have Seneca there. Along with it, you have phytostigma and dubosia. Musca valitentis. Solanum lycopersicum. It is there. What all are giving is my experiences, and the literature is available for you. What is the indication? धूल लगे तो छींका आता. Sneezing on least exposure to dust. That's it. धूल लगे तो छींका आती. Dust allergy. Sneezing, least exposure to dust. If it is asthma, least exposure to dust, you have your pothos. Pothos is that, but pothos doesn't work here, please. You can give a bucket of pothos, no work, it doesn't work. But if you get the patient gets sneezing after exposure to dust, it is Solanum lycopersicum. My teacher, Dr. Yadagiri sir, used to give this. I learned from him, and I started giving. He was my senior. That time I was working in surgery department. He was giving it, and I learned from him, and I started giving it. Wonderful result. Many what we give Arsal, Barsayod, etc. Give a dose of Solanum, especially if it is dust. You have this. Solanum lycopersicum. Verbascum. Trigeminal neuralgia. Immense relief to the patient. People of 40 years, 50 years, they come and sit in front of you and cry. Literally, they say mandu, that as if it is pinched with the tongs. This is verbascum. If it is due to dental caries or extraction, you have Hekla lava. There your verbascum doesn't help, right? Verbascum is trigeminal neuralgia, sensation as if. But if it is due to dental caries or tooth extraction, trigeminal neuralgia, you have your Hekla lava there. Your meserium is another drug here. It will definitely help, right? Verbascum. A drug for alopecia areata. What is alopecia areata? Here and there, not this. What I have is androgenic alopecia, male type baldness, right? But alopecia areata, a patch here, a patch there, a patch here. And this spot, gray hair comes.
Vinca minor.
And this is also drug for pica polonica. All right? Usually what I do is for, again, Dr. V. Prasad tip. I don't know from where he got it. I found the result. I grab with both my hands. He says, apply Baretta Carb 6X in olive oil and apply that area, you get hair. Right? Baretta Carb 6X. That's what he told. You can also try. There's no harm, isn't it? Homeopathy medicine doesn't harm. There's no reaction there. And I too found agreement. I also did in the same patient. A lot of Baretta Carb. I asked the patient, I didn't apply, but I asked the patient to apply. No result. Patient was a heart patient, fluoric acid, no result. Then she said, sir, I'm getting gray hair in this spot. Then I referred my repertory, and the drug is Vinca minor. Vinca minor is the drug, please. Gray hair in alopecia part. And after giving Vinca minor, she got back her hair and the gray hair turned black. There was no gray hair there. That is the action. That's what. If the drug is indicated, that's it. Nothing will stop you. This is the indication. I usually do off the record. Where you don't, my teacher taught me. Baretta Carb 6X. Thoda leke olive oil apply karo. You get the hair. And Vinca minor, gray hair comes. Let it be anywhere. Alopecia areata with gray hair. Right? Vayati already I told you. Right? Itching of the soft palate due to cold and sore throat. Always it's there. That is Vayathia. And the last drug, of course, keeping the time constraint. I prepared only few. A lot are there, but we'll do it a little bit. Sabadilla. What is that you're seeing there? Though the screen is like this, but definitely you can make out something. Lot of lacrimation. Eyes are red. Nasal discharge. Right? It is a coryza. It is Sabadilla mimics pre-eruptive stage of measles. It mimics pre-eruptive stage of measles. I took my nephew to Dr. Ramakrishna Reddy sir, where my nephew had this problem. He said, it is nothing but Sabadilla, you do Sabadilla. Why did you bring him here? I was third-year student at that time. And one more guiding feature of Sabadilla is thirstless. Highly chilly, thirstless, redness of eyes, lacrimation, nasal discharge. You can see that. What you see, it is Sabadilla. In this way, there are many more drugs are there in our materia medica, which in due course of time you will also be using them. Why my aim of telling you now is the drugs which I learned at the age of this is you're exposed to that at a very young age. You have now few more things to add, right? Which I learned at 50th year. You are learning at a very young age of 25, 30 years. That's it, right? Definitely they are there. There are a lot of drugs are there. Okay, and they give excellent results. So let us see what is Sabadilla stand for. Hay fever, spasmodic season, warning, coryza, severe frontal pains, redness of the eyes, lacrimation, etc. And one grand feature is highly chilly, like your Hmat self, and thirstless. This, I would like to conclude a brief exposure of rare drugs to you, right? And the last is, any questions? Any questions? You can ask me. Okay, no questions? I didn't get you. Can you be a little bit louder? The question is that most of you had this doubt. What is the take? Now, how did I practice then? They are available. What we did when we are doing an internship, we opened Boric, we made a list, internees, 5-6 internees, we divided the amount, and I purchased 300, he purchased 300, he purchased 300. In this way, we all purchased from Ramakrishna Homeo stores. In 83, there was only 2 Homeo stores, one is Sagar and other is Ramakrishna. And we purchased from Ramakrishna Homeo stores, we kept it on the table, and we started giving. Yes, they are available. They are available. Now we have a lot of things have come. You have St. George is there, we have Wilmer Schwabe is there. Right, that time we had only Ramakrishna Homeo stores and Ramakrishna Pharmaceuticals. Right, but definitely it has, yes, they are available. They are available. What all the drugs I told are available in the marketplace. Right, so finally, I thank
remedy for white
for a patient hearing. Thank you. Thank you. Thank you, sir.
Thank you, sir. It was a very great, I think, amazing session for all of us, for our beginners like us. Thank you so much. Now I request our President, Dr. Gopal Krishna, sir, General Secretary, Dr. Durga Prasad, sir, to offer memento to our speaker, Dr. Rajni Chandra, sir. And I also request our Vice President, Dr. C.V. Swami, sir, and Dr. Manik Prabhu, sir, to accompany. Thank you, sir. So lastly,
Yeah, whoever it is offline, I believe. Offline question. Online question, right. So what I did is I just gone through the materia medica of boric, seen the indication and tried to use this remedy. Why? Because it says that it is dissipates the tumors. So why shouldn't I try this? And I have tried. That's it. But most of the drugs, what I got giving you the information is from boric, right? But Clark dictionary is also valuable. One, you have 3 volumes are there. Please go through that also, right? And all the latest drugs which are coming into our day-to-day practice, they also are wonderful, very good drugs. go through the literature, right? Definitely they will be helpful. Anything? White hair remedies, I say it's only hair dye. In fact, I'll tell you, I have gone through the net regarding this white, gray hair. Don't say white hair, we call it as gray hair. I read almost 5-6 pages and I was just browsing for the treatment. And last the treatment was dyeing hair dye. But coming back to the homeopath, I think constitutional medicine might help, may help definitely. Me, what I say is, our homeopathic drugs, at least they may not turn the gray hair into black, but at least they stop further worsening or further increasing the number of white hair. But always the constitutional remedies will definitely play a role. It's gray hair is a multifactorial. It's a multifactorial. When we were students, never we had a gray hair. Never we had a gray hair. When I say students, I'm talking about students of first class and second class, please. Now first class and student is taught, what is that? IIT training in first class. I don't know what they are going to teach, right? From IIT training is taught from first class students. This child is under a lot of stress. And we are not exposed to such kind of chemicals in the form of soft drinks as you are exposed to now. I never had a cool drink. I had it only after inter. If at all I had, I was never allowed to drink tea also till inter. Okay, inter was my landmark or some boundary my father has kept. So also my whole family in the same way. We were not exposed to the stress. We are not exposed to the chemicals. We are not exposed to many things which you are exposed to now. And that is the reason the gray hair is very much common here, right? And as one more point I would like to tell regarding this alopecia areata, they say it is penu korkudu in Telugu, and it's never a penu korkudu. I don't know whether you follow Telugu or not. Lice. Okay. लेस को क्या बोलते हिंदी में? Lice. No, it is an autoimmune place. You all know it is an autoimmune disease. Sharing the comb doesn't spread alopecia. It is an autoimmune disease, right? And nowhere related to what you said or what you say lies, right? Any other I would like to take? That's it? Okay, thank you once again for the people who have heard off the line and on the line again. Thank you. Thank you.
Thank you very much, sir.
Thank you, sir. Lastly, I request our Joint Secretary, Dr. Gautam Ralabandi, sir, to propose vote of thanks, followed by national anthem.
Yeah. At the outset, I profusely thank our distinguished speaker, Dr. Rajni Chandar, for having given very informative, very illustrative, and very detailed knowledge of so many drugs and their usage. They are really widely useful. And as he said, out of his experience, he learned so many things. If youngsters are to hear, so they would be getting benefited at such an younger age. So it's a great advantage. Yeah, we are feeling very bad that very few audience are here, but at least online audience are there. But we have to put adequate efforts to see that people properly get benefited by such valuable lectures. Yeah, whoever are here, please take your part and see that many more people are benefited by attending such sessions. I once again thank Rajni Chandar. Thank you.
A very good evening to one and all. I'm Dr. Gautam Ralabandi, Joint Secretary to this association. I would like to thank the association, especially Dr. Gopal Krishna sir and Durga Prasad sir and Venugopal Gauri sir for giving me this opportunity to present the vote of thanks for today's oration. That is in the name of Dr. Gauri Bai Kirtane Memorial Oration. It gives me immense pleasure to present the vote of thanks for the oration given by one of my teachers, Dr. Rajni Chandra sir. We had this first clinical class of yours, sir. I remember in our second year BHMS, and since that day, and like you're truly inspiring to all the youngsters, to all the practitioners, to all my batchmates, my juniors, my seniors. We keep talking about you whenever we come across the experiences you have shared. Like we have discussed here more than 70 remedies now in this short time. And from these 70 remedies, almost 30 to 40 remedies I've been practicing only because of you, sir. You have shared the experience in our clinical classes, in our classrooms, in the OPs, especially the remedy which you discussed, Hmat, ameliorates by flexing. This was, I've seen the case when you were treating in the OP. The result was shown within a week after prescribing Hmat 200 to that patient. And thank you. Because of you, I started going through Pathak Triparthi, sir. Only because of you. And I'm practicing now since last 7 years. I'm quite successful in my practice with the rare remedies, of course. Thanks a lot for giving me this opportunity for presenting the vote of thanks. Thank you one and all for your patient hearing. On behalf of association, I would like to thank once again. Thank you.
Before we conclude the session with the national anthem, I congratulate the newly wedded couple, Mr. Dr. Gautam Ralabandi and Dr. Sai Sruti. And I request our president, Dr. Gopal Krishna sir, just to honor them with a bouquet, only single bouquet, because they two have become one. Please, sir. Okay. Incidentally, you happened here.